Welcome back to our channel, where we bring you informative and engaging content about medical advancements and procedures. Today, we will explore a topic that affects millions of people worldwide: heart bypass surgery. Join us as we delve into the fascinating world of cardiac surgery and discover how this life-saving procedure is performed. Hello, everyone. I'm your host Raja, and today we will be discussing, how does heart bypass surgery work? Heart bypass surgery, also known as coronary artery bypass grafting, CABG, is a surgical procedure used to treat severe coronary artery disease. This surgery is often performed on patients with blocked or narrowed arteries, which can lead to heart attacks or other serious complications. But before we dive into the details of the surgery, let's understand what coronary artery disease is. Our heart requires a constant supply of oxygen and nutrients to function properly. The coronary arteries are responsible for delivering these essential resources to the heart muscle. However, over time, these arteries can become clogged with fatty deposits, leading to a condition called atherosclerosis. Atherosclerosis restricts blood flow to the heart muscle, causing chest pain, known as angina, and increasing the risk of heart attacks. When the condition worsens and medication and lifestyle changes are no longer effective, heart bypass surgery becomes a viable option. Section 1. Preparation for heart bypass surgery. The first step in the heart bypass surgery process is the preparation phase. The patient is carefully evaluated by a team of medical professionals, including cardiologists, surgeons, and anesthesiologists. During this stage, several tests are conducted, such as electrocardiograms, ECGs, stress tests, and imaging scans, to assess the extent of coronary artery disease and determine the most appropriate treatment plan. Once the decision to proceed with heart bypass surgery is made, the patient undergoes a series of preoperative preparations. These may include discontinuing certain medications, such as blood thinners, and ensuring the patient is in optimal health before the procedure. The patient is instructed to fast for a specific period before surgery to minimize the risk of complications. Section 2. The surgical procedure. Now let's explore the actual surgical procedure of heart bypass surgery. The surgery typically takes place in a specialized operating room, equipped with advanced medical technology and a highly trained surgical team. The patient is given general anesthesia, ensuring they are unconscious and pain-free throughout the operation. To begin the procedure, the surgeon makes an incision in the chest, typically through the sternum, breastbone, to access the heart. This approach is known as a median sternotomy. In some cases, minimally invasive techniques may be used, involving smaller incisions and the assistance of robotic surgical systems. However, the sternotomy approach remains the most common method for heart bypass surgery. Once the surgeon gains access to the heart, the patient is connected to a heart-lung machine, also known as a cardiopulmonary bypass machine. This machine temporarily takes over the functions of the heart and lungs, allowing the surgical team to work on the heart without interruption. The next step involves harvesting a healthy blood vessel, called a graft, to create a bypass around the blocked or narrowed coronary artery. The most common grafts used are sections of the saphenous vein from the leg or internal mammary artery from the chest wall. The surgeon carefully prepares the graft, ensuring its viability and proper length to reach the blocked artery. With the graft prepared, the surgeon proceeds to perform the bypass. The graft is sewn onto the aorta, the main artery leaving the heart, on one end and connected to a coronary artery below the blockage on the other end. This creates a new pathway for blood to flow around the blocked or narrowed artery, restoring proper blood supply to the heart muscle. In some cases, multiple bypasses may be performed during the same surgery, depending on the number and severity of blockages. The surgeon carefully assesses the condition of each affected artery and determines the appropriate number of grafts needed to ensure optimal blood flow. Section 3. Postoperative care and recovery. After the bypasses have been completed, the surgical team gradually weans the patient off the heart-lung machine, allowing the heart to resume its normal function. The chest incision is closed using sutures or staples, and temporary drainage tubes may be inserted to remove excess fluid from the surgical site. Following the surgery, the patient is transferred to the intensive care unit, ICU, for close monitoring and recovery. Pain management, infection prevention, and proper wound care are crucial during this phase. The medical team closely monitors vital signs, administers medications, and assists with breathing if necessary. Once the patient's condition stabilizes, they are transferred to a regular hospital room for further recovery. Physical therapy and cardiac rehabilitation are essential components of the postoperative care plan. These programs aim to strengthen the heart, improve cardiovascular health, and help the patient regain their strength and mobility. The length of the hospital stay varies depending on the individual's overall health and the complexity of the surgery. Generally, patients can expect to stay in the hospital for about a week, although it may take several weeks or even months to fully recover and return to normal activities. Section 4. Outcomes and risks. Heart bypass surgery has proven to be highly effective in treating coronary artery disease and improving patients' quality of life. The surgery helps alleviate symptoms such as chest pain, reduces the risk of heart attacks, and improves overall heart function. However, as with any surgical procedure, heart bypass surgery does carry some risks. These include potential complications such as infection, bleeding, blood clots, stroke, or adverse reactions to anesthesia. The surgical team takes extensive measures to minimize these risks and closely monitors the patient's condition throughout the procedure and recovery. It is important to note that heart bypass surgery is not a cure for coronary artery disease. Lifestyle modifications, including a healthy diet, regular exercise, and medication management, are crucial for long-term success. These measures help prevent the progression of the disease and the development of new blockages in the future. And there you have it. We've explored the intricacies of heart bypass surgery, from the preoperative preparations to the surgical procedure and postoperative care. Remember, if you or a loved one is facing coronary artery disease, consult with a qualified medical professional to discuss the most suitable treatment options. Thank you for joining us today. If you found this video informative, don't forget to like, comment, and subscribe to our channel for more engaging content on medical advancements and procedures. Take care, stay healthy, and we'll see you in the next video.